Assalamu alaikum wa rahmatullahi wa barakatuh. Ahlan wa sahlan, a warm welcome to Muslima Insight. Today in Muslima Insight, we are going to take a look at the topic of suicide. What are some of the preventative measures we can take, some of the warning signs, as well as risk factors, and the aftermath, the effect that it has on people that stay behind. And with me in studio to share with us their knowledge on the topic, we've got the lovely Dr. Nazmira Kamisa. Assalamu alaikum and welcome. Thank you for joining us again.
Wa alaikum salam. Thank you for having me, Adila.
And then we also have got Nazia Ismail from the SADC group. Assalamu alaikum and welcome, sister.
Wa alaikum salam. Jazakallah for having me.
Sisters, when we talk about suicide, obviously it is something very severe. It affects not only that person that is going through the trauma. Just recently we mentioned how much it takes to take a life of another person. I mean, one can imagine what a person has to go through to actually take your own life. Looking at South Africa in particular, what are some of the statistics? Do we have statistics available?
As you said, you know, it's such a difficult topic to discuss. It's such a difficult issue for many people to understand. But I think what's important to understand when it comes to suicide is that sense of hopelessness, that sense of feeling like there's no other way out, there are no other options, and the only way is to end your life. The statistics in South Africa are quite alarming. In South Africa, there are currently 23 completed suicides every single day, while there are 230 attempted suicides. That is a large number of people in the country who are feeling hopeless and who are feeling like there is no other option available to them besides ending their life.
Sure. That is quite alarming. You know, it's stuff that we don't always hear. Are there specific age groups that are more prone to committing suicide?
If we're looking at adolescent versus elderly people, the rates of suicide are higher in elderly people. They historically have always been higher in older people because rates of depression tend to be higher, loneliness, loss of a spouse, physical complications or illness tends to develop later in life. And they also tend to be more serious suicide attempts. So we have higher rates of completed suicides in the elderly. And this is because they usually take steps to prevent themselves from being found, and it's very carefully planned in most cases. However, we do have quite an increase in recent years in adolescent suicide, which is quite disturbing, and hence recent PR and attempts in the media to publicize this and to create awareness about suicide in teenagers and adolescents. So what we do see is almost like a paradox. We see a higher amount of suicide attempts in adolescents and in young people because they tend to behave in more risky ways. They have higher rates of abuse of substances like alcohol and drugs, which then obviously is a great risk factor for suicide. So we have more attempts. Like, you know, Sister said, we have 230 suicide attempts daily, but 23 completed suicides. So the gap is huge. So if we're looking at that number, there's a higher rate of, a higher component of that is young people and adolescents, but the completed suicides tend to be the elderly.
Sure. And is there a difference between the ratio of men versus women committing suicide?
It's a similar, you know, this is called the gender paradox in suicidal behavior. So more females attempt suicide, but completed suicide is higher in males. So men have extremely high rates of completed suicides because they tend to use more fatal methods and more aggressive methods, whereas in females it tends to be different. They tend to go for overdoses or less potentially lethal methods of suicide.
And if we look at the surviving children of parents or a parent that have committed suicide, will they by chance be more prone to be vulnerable to commit suicide in their own lives?
They are. They are more prone to suicide attempts. So there is some research that was documented fairly recently, a few years ago, where they found that children of parents who have committed suicide have higher rates of hospitalization early in their lives for suicide attempts. But there was not any findings about suicide, completed suicide. So these children are vulnerable to attempting suicide and attempting to take their lives. Whether these suicides are completed or successful was not evidenced in there.
Can you explain to us also the difference between having a suicide intention and having suicidal thoughts?
So if we look at suicidal thoughts, are very common. Okay, you have people who are very religious, you know, Muslim people who sometimes feel so down or so hopeless, like you said, where they do have suicidal thoughts. And suicidal thoughts can be feeling tired of living, or feeling like you've had enough, or feeling as though you'd probably be better off dead, you know, wishing that you were not alive. Thoughts like that. Those are, in actual fact, suicidal thoughts. Okay? And those come when people are in a lot of pain. So emotional, deep emotional pain. Suicidal intent with actual plan to commit suicide varies from that. Because that implies that that individual would have had the suicidal thoughts but has then taken it a step further. In other words, intending to do it and having a plan to actually commit suicide.
From your side, Sister Nazia?
That is absolutely correct. In the scale of suicide, if you want to put it that way, a person will be considered more suicidal the further along they are with their plan to commit suicide. So if they've had a thought about it, but they haven't thought of a plan or who they're going to let know or how they're going to do it, they are not as suicidal as someone who's sitting there with a bottle of pills next to them thinking about suicide. So on that scale, a person is considered more suicidal with a bigger intention to commit suicide the further along they are with their plan.
Are there any warning signs that people can look out for?
There are many things that you can look out for. An interesting statistic is that close to 80% of people who committed suicide have actually left signs of doing it before they did it. That's a large number of people who would still be here if someone sat up and paid attention to the signs they were giving off. In adults, there are many things that you can look out for. If there's a history of mental health as well as depression, it does put someone in a position to be more prone to committing suicide. If they are suddenly withdrawn from everyone, they're no longer communicating the way that they used to, it's something to think of. Also, if they're not eating and sleeping properly, if they be talking about death a lot, talking about is there hell or heaven or what happens after you pass away, if they start putting their affairs in order, that is a big warning sign that something may be going wrong. If they are getting their insurance policies together, getting their will together, and all of these signs in combination will tell you that something is wrong, and you rather address it before it's too late and you end up losing their life.
And from your side, Nasmira?
Absolutely. And you know, all of these signs that she mentioned can actually then in the end sometimes culminate in a point where the person seems well, so they look better, they're not sad anymore, they seem happy almost, and people then relax or stop worrying, and that is also a sign. That is potentially a sign that the person has resigned themselves to committing this act, and that they now feel that the plan is in place and that everything will be okay because it's going to be over soon. So that as well is a sign to look out for.
And it almost makes it more dangerous because now that person is more at a psychological ease, and it's easier for them to follow through.
They found a way out. As I said, it's that hopelessness and not knowing how are you going to escape this problem. They are relaxed, they're calm, they're happy because they know their way out, which will make them more suicidal than someone who's actually still contemplating it and still concerned about how if there's another way to escape their situation.
Coming to the youth, is there anything in particular that one can look out for among teenagers?
Some of the warning signs that you can look out for specific to teenagers are giving away their priceless belongings as well. So teenagers value items a lot, and if they start giving away things that you know they wouldn't, a precious soccer ball, maybe a favorite dress, and saying things like, it's okay, I don't need it anymore. Those are some of the warning signs. Also, a very good warning sign is to pay attention to their schoolwork, to pay attention to their writings. What are they talking about? What are they drawing? Those are all signs of what they are thinking about. And if it's about about death, if they're talking about death, if they're writing about death, about suicide, it may not be that they are suicidal. There may be something else that's affecting them, but don't ignore the sign. Rather, discuss it with them, bring it up, find out what is going on, so that you can get them the help that they need before it's too late.
Absolutely. And then also coming to aspects of risk factors. Are there certain people in society that are more vulnerable to fall prey to becoming suicidal?
People who, the primary risk factors, so we have variations in age, in gender, in social class, in education. And if we look at those specifically, in context of risk factors, all of those risk factors, which we will discuss, are generally intensified or are worsened by the presence of depression and substance abuse. So those are two key risk factors that we will probably need to discuss.
Absolutely.
There are other risk factors that you can look out for, things like a genetic predisposition. As we mentioned earlier, would it make someone more suicidal if their parents have committed suicide? It does put them at a greater risk of mental health itself.
And then would you say that a person that is depressed for years, and perhaps they are going for the therapy, perhaps they are going through the motions of trying to get out of it, but the ultimate way out would be the committing of the suicide?
Yes, a lot of the times that's how people feel. They feel like the only way that they can actually escape the problem is the way out. It takes someone to open up their mind, to show them an opportunity and give them a plan of action for them to follow through step by step, in order for them to stop that box of thinking, in order for them to step out of that box, to actually see that they need some help. But it's not always the case.
On that note, it is time for us to go to an ad break. Stay tuned. Assalamu alaikum wa rahmatullahi wa barakatuh. A warm welcome back to Muslima Inside. Before the break, we were talking about some of the risk factors. Are there some examples that you can relate to the viewers as what if you've come across at SADC, at your practice?
So untreated mental illness is a very, very big risk factor for suicide. Untreated depression, untreated bipolar mood disorder, schizophrenia, and then substance abuse. So substance abuse is a key factor in precipitating episodes of suicide. So you can have people who suffer from depression, who do have suicidal thoughts, who do feel tired of living, who do have that deep despair or depression, and who feel that they cannot go on living, who may not actually act on those thoughts. Okay, but in the presence of substance abuse, for example, using drugs or using alcohol, they do become more impulsive, and they are more likely then to act on their suicidal thoughts, which then takes them further on the spectrum that that the sister discussed, into having a higher risk of suicide. So we look at suicide in the terms of risk. So in psychiatry, we would do risk assessment. And risk assessment would include looking at all the factors that we discussed. So demographic factors like age, like sex, like social status, education. So higher levels of education do tend to be protective against suicide. People who are more aware, who are more well off in a sense, and higher socioeconomic situations do tend to have a lower risk of suicide. However, there are some exceptions. So if we're looking at specific professions like dentists, they say, and certain physicians, doctors, or anaesthetists, there are reports that suicide rates are higher in those individuals, and that is likely to be because of access to potentially lethal drugs, as well as combined with high stress levels. And then family problems, or lack of support, or lack of social support, not just family. Marriage is protective. So in married people, suicide rates are much lower. These do, however, tend to increase after somebody is widowed or divorced. And then social situations, so family, friends, relatives, neighbors having a community around is protective.
Just to take it a few steps back, you mentioned people with perhaps higher level of income. So would you say that poverty plays a huge part in driving a person towards committing suicide?
Yes, poverty is one of the demographic risk factors for increased risk of suicide. Poverty, deprivation, lack of access to resources, general life difficulty and adversity will be the predisposing factors. And then with that will come with lack of access to help and to resources and inability to have that money to be able to pay to go to the GP or to go to the psychologist, you know, not being able to have a medical aid, for example, to be able to see a psychiatrist. And I think that's where SADAG comes in.
Yes.
You know, they provide the service in the community, which is invaluable, you know, because anybody can pick up the phone and get help.
From your side, sister, how can we make viewers out there more aware that there is a service? There are other services as well, and then get people more on the ground into the communities. What is SADAG doing?
Well, the biggest problem with mental health in South Africa and suicide is lack of awareness and education. We've got so many different cultures, and we talk about the different problems that people are experiencing, but we don't recognize mental health. We don't recognize mental health as a serious problem that is treatable and can be managed. The stigma that surrounds talking about it, that's saying, I have a mental health problem, I'm seeing a psychologist or I'm seeing a psychiatrist, is huge. People think they will be judged as crazy, as not being able to manage their own lives, and as weak, which no one wants to be seen as. And this is what SADAG aims to reduce. We would like to create as much awareness as possible around issues of mental health, whether it's depression, whether it's bipolar, substance abuse, suicide. We want people to know that there is support. 1 in 3 South Africans actually suffer from a mental health problem. So there is a large amount of people dealing with it, but no one talking about it, no one accessing information. So we would like everyone to know that there is help available, no matter what you're going through. Talk to your neighbor, talk to your loved ones. If they say they have a mental health problem, don't ignore it or judge them, but support them. Discuss with them the options they have available, and that there is a service like SADAG, who they can pick up the phone to speak to in order for referrals to a mental health resource, no matter how much you can afford and no matter where you are living.
And I think listening to you as well is, I think especially for the younger generation, the stigmatization. And I think, like you say, the education has to come forward, that they need to realize that it is not a death sentence. If somebody says, now you are bipolar or you are like this or that, for them to realize that it is a phase in their lives that it is treatable.
Absolutely, absolutely. And this is a key thing. I think in the past, because there was not awareness of mental health and what it entailed, and that it was a biological thing that we could manage, stigma developed. And because it is such an overt thing in society where behaviors can become uncomfortable for people around, so seeing somebody with schizophrenia or seeing somebody who is in a manic phase of a bipolar mood disorder is uncomfortable for people around them. Okay, and these people do things that make you feel uncomfortable, and they can be inappropriate, and they can act out, and hence stigma is alive and well. And we as a society have over time historically come to a point where we blame that individual for that behavior, as if it was a conscious choice to behave in that way. I think slowly but surely now things are shifting, where we're beginning to understand you cannot say to that person, okay, now get up, just snap out of this. If somebody is depressed, snap out of this depression, get up, do something, because that person is not able to. And this is because they have a chemical imbalance, they have neurochemistry, they have specific chemicals in their brain which are not completely in balance. And this then leads to this type of behavior. So looking at that, medication is often a big component that is necessary, but then also psychotherapy and support. And looking at holistic therapies, like we're looking at the power of massage or reflexology, on how that can affect cortisol levels in your brain and affect levels of stress hormones. So it's not just about relying on medication, which I know a lot of people are averse to. It's support and acknowledgement
Yes,
as
absolutely.
well.
And that absolute sense that we need to get out when you are told that you've got a problem, A, B, or C, it is not a death sentence. It doesn't mean you are regarded as abnormal. Because I think for a teen, that's one of the biggest fears. There's something wrong with me. I'm not normal anymore. Sister, from your side, what have you experienced?
60% of teenagers who have mental health problems don't get treatment because why? We're scared to talk about it. We're scared to share the information. We're scared that we're going to feel judged and we're going to feel different. And that is one of the biggest issues that our youth face. They don't want to talk to their friends. They don't want to talk to their loved ones about how they're feeling, because when they do, they will be seen as either that they are incorrect or they're not managing their life well, or that they're just looking for attention, which will make them seem even weaker. So SADAG aims to change that, to help people understand the signs and the symptoms of depression, of suicide, not only in themselves, but in their friends, in their loved ones, so that they're able to step up and say, you need help. It is treatable. There is help available. The only option is not to end your life. At SADAG, we receive over 400 calls a day from people around the country experiencing so many different mental health problems. And we have help for every single one of them. That shows that no situation is hopeless. There is help available. You just need to take the step to look for it.
So what approach would you take if a person now, let's say, calls in? What is the first step that counsellors would take over the phone?
The first step is to identify the immediate dangers. Of course, it's important to identify how far along they are in their plan. As I said, it's important to know, are they just thinking about it, it's just a thought, or do they have an action plan? And how far along are they with that plan? We receive calls from people who are contemplating it, whereas we'll receive calls from someone who's standing on a bridge who's about to commit suicide. So people are at different stages, and if they are at that stage where they're seconds away from doing it, the most important thing is to get them out of that immediate danger, getting them out of that situation, getting them away from that, and then calling them their support, as well as getting them to the nearest mental health facility. Suicide is not something that you can just overcome on your own. It's something that you need treatment for, you need assessments for, and you need ongoing support. And it's as critical as having a heart attack, as critical as having a broken leg. It is that important that you get to a mental health practitioner or a hospital's emergency rooms in order for you to get treatment as soon as possible. And
Dr. Nazmira, from your side, working in Westkoppies and Denmark Clinic, what course of action do you then take if a patient is then admitted? What happens next?
Initially, support. So basically what we need to do is keep them in a safe environment. So they need to feel supported and that they're not alone. So psychotherapy is important. Then being able to see a counselor or a psychologist on a daily basis in order to have that supportive sense of being contained and to be reassured that they're not alone. Another thing that we usually need to do if we've reached the point where people need to be hospitalized is for them to be supervised. So they need to be observed carefully. So we need nursing staff to be involved to do specific suicide observations depending on the intensity and the severity of each case. You know, it can be up to from 1-to-1 observations where somebody, a nursing staff or a care worker, will sit with that individual until we feel that the risk of suicide has decreased sufficiently, to the point of having to go and check on the person every few hours to ensure that their safety is maintained. And then obviously preventing access to weapons, because people do sometimes carry weapons with them. Sometimes they use things. Hanging is a very common method of suicide. We've seen this happening in the hospitals where people will attempt to use sheets, pieces of clothing to attempt to hang themselves. People smuggle razors or little instruments which they can then use to cut themselves. Because, you know, another aspect of, you know, on that spectrum of suicide is self-harming. So cutting the self, which is completely a different topic, is also related, however. So we need to ensure that they're not harming themselves, as well as, you know, ensuring their safety when it comes to suicide. And then we need to look at them in a biopsychosocial way. So biological is important as well. So from a biological perspective, then we would need to do an assessment and ascertain why. You know, what is there? Is there a mental disorder in the first place? And if there is mental disorder, is there substance abuse? And then look at managing that with medication, with psychotherapy, with support, with occupational therapy. There's hypnotherapy. We have specific therapies for trauma, which is often a trigger for suicide. And then we combine all of these, and it's often it's usually individualized to that specific person's needs.
So it's almost taking trying to address the issue from all angles, because like you said, there is the biological aspect of the chemicals in the body that is imbalanced. There is the psychotherapy that needs to come in because there might be a psychological problem. So in actual fact, it is really placing that person in a lot of safety.
Absolutely.
And it's again for our viewers to realize it does not mean that now this is a life sentence, you are going to be there forever. In that phase is where you're going to find the help that you need.
In that phase, and that is the key thing that you say. It's about containment during that time, to prevent, to help you get through that, come out the other side, and to instill hope.
On that note, it is time for us once again to go to ad break. Stay tuned. Assalamu alaikum wa rahmatullahi wa barakatuh. A warm welcome back to Muslima Inside. Sister Nazia, from your side, you say that once the counsellor has answered the phone, they obviously ensure the safety of the person. What do they do then?
SADAG works in a system of contain, counsel, and refer. So we would contain the situation, get them out of the immediate danger, make sure that they are in a place where they are able to listen to us. Then we counsel them to the best of our ability to make them feel that this is not the only option. As I said, people who are suicidal, they see that as the only way out. So we do need to open up their mind, discuss with them a plan of action of getting them on the road to feeling better, gaining their trust in us in order for us to assist them, and then referring them. Of course, our referrals don't just end there. We would take them through the facilities, making sure they get to the correct hospital, being referred to the correct doctor, making sure there's a bed available if they're going the government route, directing them to their psychologist if they have medical aid. But we would be able to assist them with the referrals in order for them to get the assistance that they need, with follow-up calls and support. It's another person in their corner with a plan, able to help them as much as possible.
And would you say that, I know in ethnopsychology what we do is we always try to get to the root cause, because all of the stuff, all the psychosis that may come up during a person's lifespan, due to all the issues that happens that is not dealt with, it's almost a culmination of all of that takes the person to that point where they say, "No, I've had enough." So, would you say in your counselling that you try to get to the initial sensitizing event that perhaps has happened when this person was 16 or 15 or 10, and due to that suppression and repression of the emotions, that's why this person has now come to that point in their lives?
I think that is a very, very deep understanding, and it's a deep question, because it gives us the answer in a way about looking for the root cause, because treating the symptoms will only help us for the short term. So monitoring this person, we cannot observe them for a lifetime. We cannot keep them in hospital indefinitely. And we can medicate specific symptoms and specific things. However, I always tell my patients, I can give you this medicine. It's going to help you to cope, but it's not going to heal you. You're going to heal yourself. And only you know how you're going to do that. And that refers back to the process that you've described. So it's unpacking a lot of emotional and psychological traumas and events that have led up to that event. People rarely commit suicide without any warning signs, like you've said before. There are usually signs and there are usually symptoms which are warning signs and red flags which will let you know that something is not right with this person, and that usually happens over a period of time. So I find that referring the patients for psychotherapy with a good psychologist who is good for them. I mean, psychologists are good. Someone who is good for that individual, who they will feel comfortable with, who they can communicate with and connect with and open up with, is a very vital part of the treatment plan, because without that, we're just medicating the symptoms, but we are not actually treating the root cause, like you described.
Absolutely. So the fact that this person is at that place where they want to commit suicide is really the symptom that has brought that person now into the rooms. And then the idea is to, whether you use Gestalt therapy technique, regression therapy and hypnosis, but to try to get that person to unpack these issues. And I mention these things so that our viewers know what does this counseling involve? What does the psychotherapy involve? Because I think for a lot of people, they are very fearful to revisit old hurts. But if you cannot feel, you cannot heal.
Absolutely.
And that is part of the process, that they need to let us remove the fear that there is a place for us. There is a place for healing, in other words.
The fear is often there, and we sometimes fear revisiting these memories and these feelings and these emotions. But it's already happened. It's important for people to realize that the worst has already happened. So you're revisiting the emotion or the feeling or the memory, or unpacking that stuff that may have happened when you were, like you said, 16 or 10 or 6 or 4, is never going to be as painful as it was when you were that vulnerable young person at that time. And it's important as well to look at, who you are now. You're an adult. You can be there for yourself. You are not alone anymore. You are not vulnerable and alone. And it's hard. It's easier said than done. You can say this to people so easily. But with support, it's possible. And for me, it is also about, in dealing with my clients, that you need to discover the wisdom in the wound. I mean, we are in earth school. We are not in heaven. So we can't expect life to be perfect. So in life, you're going to have your issues. You're going to have what happens or happened to you as a child. And for you then to have the courage to revisit that, you can derive the wisdom out of the wound. And I think that is what, Dr. Nazmeera, what you've referred to earlier, is to find the meaning in your experience. To see, because when we obviously experience life with our 5 senses, and that then becomes our internal movie, we give a meaning to that experience. And when we can start changing what that meaning of the experience is, and we can look at that and say, once we've obviously had now a couple of sessions of, let's say, hypnotherapy or counseling, where the person can now look at that experience and say, I thank you, you have taught me, I'm taking the good out of it. Because ultimately we're in Earth School and we're here to evolve and grow as human beings. Taking it a little bit further, how can we get issues such as suicide more out into the open? So addressing, I think this is more your thing, but addressing stigma, in the media and in the public, addressing stigmatization of mental illness in order to enable people to be able to talk about it and then to be able to access help. And then, obviously that's a great suicide prevention mechanism, because we need to admit that suicide is preventable. It is a wholly preventable cause of death.
And would you say, if we change our approach in the sense that we look at it as your mind is, your brain is just another organ in the body, and like you can get diabetes or liver problems or etc., would you say that will help?
I use this analogy all the time, because people tend to feel that having a mental health problem or a mental disorder is very different from having a physical illness or a physical disorder. But like you said, the brain is part of the body, and the brain chemicals and the neurochemicals are also hormones or neurotransmitters in your body. So like insulin is in your pancreas, serotonin and dopamine and noradrenaline are chemicals in your brain. So I often ask people, if you were diagnosed with diabetes and you were prescribed insulin to take for the rest of your life, would you take it or not? And the answer is usually yes. Or if you had high blood pressure, would you take those tablets every day? And absolutely yes, without a shadow of doubt. Because I don't want to have a stroke and I don't want to go into a coma. Yet taking your medication for depression, or if you have a mood disorder or a psychotic disorder like a schizophrenia, where you need to take this medication lifelong, and there are situations where this is the case, why is it that we are unable to, resolve, to be able to accept that?
Sure,
that is the same thing. The mind is an expression of the brain. and the brain is a physical organ. So this, for me, comes down to stigma and the stigmatization of mental illness and our inability or our unwillingness to recognize it as such.
And sister, from your side?
That is the biggest thing, is the awareness and the education. And people need to understand that mental health is a serious problem. Like you said, it's just like diabetes, it's just like cancer. It's something that affects you physically and as well as your emotional state. Mental health is linked to so many problems, and that is why so many people experience it. We discuss the risk factors. Whether you have financial problems, whether you have a chronic illness, whether you have difficulties in your family, that can all result in a mental health problem, depending on how you manage it. So there's different triggers and different factors that affect everyone. It doesn't mean that you aren't able to manage your life. It doesn't mean that you are weak. It doesn't mean that you have to be judged now because you aren't able to cope with the stresses in your life. It just means that different people deal with different things. What we often say at SADAG is it doesn't matter if your dog has died and you're suicidal, or you've lost a mum and that's why you're suicidal. What matters is what this problem is doing to your life. Is it affecting the way that you feel, the way that you think, and the way that you behave? If it is starting to affect your life in a negative way, it's something that you need to pay attention to and something that you need to get help for.
Shukran, sister. On that note, it is time for us to go to an ad break. Don't go away. Assalamu alaikum wa rahmatullahi wa barakatuh. A warm welcome back to Muslima Insight. Sisters, coming back now to mental health, to get it out in the open, what can students that is at high school, they are perhaps at varsity or college, what can they do to get their institution more involved, to get the talk about suicide at a more acceptable rate?
You know, like, for example, if people have health awareness programs, so if they have talks or specific events to promote healthy behavior or healthy eating or nutrition, exercise, if we can incorporate mental health into that, you know, because like we said, our brain is a part of our body and our mind is connected. So if we can incorporate not only physical health, but mental and spiritual health as well, you know, I think it would be a more holistic and a more realistic way to portray the individual's lifestyle.
Sister Naza?
The most important thing is to get people talking about it, and that's what SADAG does. So SADAG runs a school talk program called Suicide Shouldn't Be a Secret. So we go into schools and we speak to only high school students because we find that that's the age that they're most responsive, they're able to understand the information best because it's such a sensitive topic. And we speak to students class by class on issues of mental health, speaking about depression, what are the signs and symptoms, what do you need to look out for, and suicidal, what to do if someone tells you they are suicidal. A lot of the time, people would like to keep quiet about it. They don't want it because it's a secret that their friend has shared with them. And the most important part of our talk, suicide shouldn't be a secret. You need to tell someone if someone is suicidal. So we go in, we find out what these students are dealing with, and we also give them a safety net of calling SADAG if they are feeling suicidal, if they feel they aren't comfortable to talk to their parents, to their teachers, or to their friends. They have the SADAG toll-free helpline number to give us a call so that they can get the assistance that they need.
And coming now to schools on their own, because now obviously the SADAG program is not in every school. What can schools do on their own to be more responsive to a child that is in crisis? They, for example, have picked up this child, there is problems, the child is suffering with depression, and there is a risk factor there. What can the school do?
The key factor is to respond as soon as possible. Do not ignore it. Do not feel that it will just go away or not take it seriously. If you feel that a student is suicidal, contact the parents. Find out what is actually going on. And you can also call SADAG if you're unsure of what the procedure is in terms of getting them to some sort of a mental health professional. But it's important that you create a supportive environment. Do not dismiss their emotions. Do not dismiss their feelings. And also incorporating these topics into your life skills, into your programs, making sure that you are educating your children on mental health, on aspects of suicide and depression, so that they can feel comfortable enough to share it with someone if they are experiencing it.
So there's an absolute sense of becoming proactive. Be proactively involved, because I mean, your children spends half their lives in a school, half their day they're in a school and half the other day they're at home. So that's a great place to get that support system going. Then coming also to understand what is the most misunderstood aspect about suicide-related thoughts or about people committing suicide.
I think there is a culture of thinking or saying that people are attention seeking, you know, that a suicide attempt is a cry for attention. It is a cry for help, okay, and you know, it can never be dismissed. So looking at an individual who has attempted suicide and maybe not being successful, these people are often judged for having done that thing. But you know, I think it's important to get across the message that we look beyond that. We look at the individual, look at the pain that lies behind this type of behavior, because it's a signal, and ignoring that signal can then obviously end up in losing that individual to suicide in the future, because we know that previous suicide attempts are predictors of future suicide attempts, or individuals who have attempted suicide in the past at a higher risk of completing a suicide in the future. So this is a sign, and it's a signal, and it's an opportunity, you know, for people to then address issues and to open up and to speak and to get help for that individual, so that you can begin to understand what is going on and acknowledge what is going on and then get them help. Especially looking at adolescents, a very misunderstood group of people, you know, and this is a way that they can speak by acting out in this way.
And it is really that cry for help. It is not to manipulate. Some people will misread and misunderstanding after just trying to manipulate the situation again, and that is exactly where it becomes so vital not to do that, because that misunderstanding, like you say, can cause that person then to go and commit suicide.
Absolutely, because then they are completely alone. They have probably felt alone for a long time, but this then could likely then, you know, confirm to them that they are misunderstood and that they are alone and that nobody cares.
So it's vitally important that our schools become proactively involved, that that education that has to take place. And almost, is it not that most schools do have a psychologist or a counseling psychologist on their premises most of the time?
With government schools, what tends to happen is that there's one psychologist that's attached to a particular district. So if you think about that, it's an overwhelming responsibility on one person's shoulders to be able to deal with all that, all those students, all their emotions and what they are experiencing. With the private schools and the more affluent schools, yes, you do have that opportunity of having a counselor on site. There is a tendency now of people becoming more open to understanding that there needs to be a counselor, there needs to be a psychologist, there needs to be some sort of psychosocial support in order for students to start feeling that they are comfortable to talk about their emotions. But in terms of the government facilities, we do still have a long way to go in ensuring that they are able to assist the youth when they are suicidal. That's where NGOs like SADAG come in. If you do have a student that's suicidal, you're not sure where to go, who to speak to, give SADAG a call on 0800 21 22 23, and we will be able to take you through those steps of getting help and what procedures should you follow to get that student some help.
Absolutely, shukran for that. And then also, I think what is very important is that we need to touch on, you've mentioned previously, obviously we never keep it as, if you know your friend wants to commit suicide, you don't keep it a secret. What advice can we give to that person? What should you say to a person that comes to you, coming out and saying, I don't feel like living anymore, whatever it is? What can and what should we say to a person that's suicidal?
You should definitely not say things like, snap out of it, oh, don't worry, it's just a rough patch, you'll get over it. Because while we may think that will make them feel better, that there's hope, at that point that person is feeling extremely hopeless. They are feeling like there is no other way out, and by saying that, we're actually dismissing their feelings.
And you're invalidating them.
You're invalidating them. You're making them feel like what they are experiencing is not that big a deal. You can just move on from it. Another thing that you shouldn't say is that I understand exactly how you feel. Because at that moment in time, that person person, you don't understand what they're experiencing unless you've walked every step of the way with them. You aren't able to understand the raging emotions that they are feeling. The most important thing is to make them feel supported. Reassure them that they've taken the right step in telling you, that they've come to you for help, and that you appreciate that, and that you respect that, and that you will be getting them help. Do not ever agree to keep it a secret, because you could walk in tomorrow and that person could be gone. The responsibility is not only on your shoulders. It doesn't mean that you have to sit with this information and now you have to become the counselor or the psychologist. You do not have to do that. Your responsibility is to share that with someone who knows what to do. If you are a teenager, speak to a loved one, speak to a parent, speak to a principal or whatever it is. And if you are just an adult, speak to a professional. Give SADAG a call and find out what plan of action can you put together to present to this person so that they feel safe, reassured, and hopeful.
Absolutely. Nasmira, from your side?
I think, you know, it's quite a comprehensive answer that she's given, but I think support and being there for the person and acknowledging what they're going through rather than being dismissive or trying to, you know, be positive about it. I think sometimes containing somebody who's in a situation like that includes feeling with them and being there with them while they feel what they feel and letting them know that no matter what happens, that they are not alone. And then suicide pacts is something that we use on, you know, regularly, where you have a contract and you have an agreement, and this can happen between two individuals, like what I would do with somebody who, you know, was planning a suicide, is that we would agree that they will not act on those thoughts unless they came to speak to me first. And we have an agreement and we have a pact, and there is evidence that people do tend to honor these pacts.
Absolutely. On that note, we have run out of time. I thank you once again for your wonderful contribution. And yes, the numbers for SADAG will definitely be appearing on the screen. Do look out for it. And on this note, it is once again for us to remind ourselves, being Muslim, and especially for our non-Muslims as well, seeing what is happening in the world, that in Islam, suicide is not permissible. It is not allowed. And we cannot make halal that which Allah Ta'ala has made haram for us. In other words, that which is, we cannot make permissible that which Allah declared sinful or impermissible for us. And we understand that people in the world are suffering. Muslims are being there's great atrocities being committed against them, and this is where we call upon all our Muslim brothers and sisters to hold on to the word of Allah. Allah Ta'ala says that He will not bring over a soul or burden a soul with that which He cannot bear. And in that very statement, we need to look at that statement. What is Allah saying to us? That yes, He will not burden us with what we cannot handle. That means that if we believe that statement, and this is where the hope factor comes in, that if we can believe that statement and we can trust that statement, that is true trust in Allah. That is having true faith in Allah. But Allah Ta'ala also says to us that He will not change the condition of a person if they do not change their own selves. So it's very important where the aspect of personal responsibility comes in, where you have to choose to make a different choice. Choose life, choose to live, choose not to go down the old path, because if you always do what you've always done, you'll always get the same result. So let us reach out to each other. Allah Ta'ala did not make us into individual islands. He made us into communities, into societies, and we can all be there for each other. From myself, Adila, Assalamu alaikum wa rahmatullahi wa barakatuh.